Welcome to week 7. Can you believe it? Almost halfway through this term already, or semester, or course. How's that? Okay, this week we're going to talk about informed consent, and it is very, very important because informed consent supports the patient's right to decide for themselves about whether or not they want to go forward with a treatment plan or procedure or surgery. And of course, because the patient did not go to medical school, the physician is therefore legally responsible for explaining things to the patient so that they can make a proper decision, an informed decision. Okay, so you see here is informed consent is the process in which a healthcare provider educates a patient about the risks, the benefits, and alternatives of a given procedure or intervention. Now, of course, part of this exchange or this process must be the patient's ability to understand the risks, the benefits, and alternatives of a given procedure or intervention. And that is part of the physician's responsibility to assess the patient's ability to make this decision. Okay, so here we have first the establishment of the need to educate the patient and make sure that the patient can indeed understand. Now, that doesn't mean that the patient can understand complex medical terminology and anatomy and physiology concepts. The physician is responsible for explaining it in a manner with which the patient can understand, a regular person can understand, of average intelligence. Okay, so informed consent is both an ethical obligation and a legal obligation, and it originates from the patient's right to make that decision as to what he or she wants to happen to their body. This is a guarantee of autonomy, the patient's ability to make their decisions, refuse treatment, which is guaranteed in the First Amendment of the United States Constitution. Okay? It has to be documented, and part of that documentation is that assessment that I was just speaking of the physician's determination that the patient can understand and render an actual recommendation, understand the recommendation, the pros, the cons, and make a determination that's right for them. Okay? The Joint Commission, in addition to the federal government and all of the laws of ethics, or I should say the code of ethical codes of physicians and other healthcare providers, the Joint Commission, which accredits healthcare facilities and gives them, in part, the ability to provide healthcare services, says that this documentation must be in the patient record. Now, what form it takes, it can be a standardized form, it can be progress notes, whatever, but it must be documented in the patient record that this conversation occurred. Okay? And the more serious or complex the procedure, the stronger the need to have this consent in writing as opposed to just a conversation and noting that down. Okay? All right. So there are 6 elements involved in informed consent. So the first is very logical. We're going to explain the nature of the procedure. Now, we're not talking about we're going to cut here and do this, do that. It's going to be an overview, but the patient still has the right to know you're going to be mildly sedated, you're going to have anti-anxiety medication, it's going to be general anesthesia in a surgical suite, in an operating room, whatever. Okay, we're going to cut you here, we're going to take this out, we're going to retie this, whatever. Okay. The next thing that the physician is obligated to do is explain the benefits of the procedure. Why is the doctor recommending this procedure? Very, very important. The doctor has to justify why this is their recommendation, and the physician has to explain the risks all the way to death, okay? And death is always a risk of any surgical procedure, and sometimes general anesthesia, the simple matter of that. It must be explained. The patient has the right to know, okay? In addition to that, the physician must also explain reasonable alternatives. Now, understand that alternatives may be medication, okay? The alternatives may be complementary medicine, such as acupuncture, okay? It doesn't matter that this is a Western doctor and acupuncture is Eastern medicine. The fact is that if it is known, if there is evidence that bases that acupuncture can help with this condition, this physician is under the obligation of explaining the benefits of that, the possible benefits of that, and the risks of that. In addition, the physician must explain the risks and benefits of actually refusing the procedure. So what if I say, no, I don't want to have that surgery now? What happens then? Okay. And then, as I mentioned twice already, there must be documentation of the assessment of the patient's understanding of 1 through 5 on this list. Okay? All right. So that's the basics of informed consent. And basically, it is exactly like it sounds. The fact is that we need to make sure that we give the patient the education, the brief, short education, sufficient for them to make a valid decision. Yes, I want to go forward with this procedure. No, I want to wait. No, I want a second opinion. No, 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 whatever. It doesn't matter. It doesn't matter if the physician thinks it's the craziest thing in the world to refuse. People have the right to do their own thing. Okay. All right. If you have any questions about informed consent, you can email me. Okay. So this week 7, no discussion. How about that? So that'll give you more time to work on this chapter. We are getting closer. We're in the middle of the semester, as I said before. So you should now be accumulating knowledge and understanding about both laws and ethics with regard to healthcare and how they affect you and the way that you will be doing your job if you're not doing it yet. Okay. Chapter 7 is about medical records and informed consent. And I strongly suggest you review chapters 1 through 6 because you want to not fall behind. You don't want to forget about what you learned, what you read. Okay. Plus, you have test 2 coming up. That's what I got to say. All right. The weekly additional stuff is, I know it's a surprise, but it's all about informed consent. Okay. Understand that the physician himself or herself must have this conversation with the patient, not a nurse, not anybody else. Okay. If there's a language barrier, the physician is obligated to get an interpreter. Okay. And it cannot be a member of the family without proper consent from the patient. Remember, HIPAA still applies. Okay. Test two. I just said that. Test two is coming up. Okay. And so that's all I have for you today. And I want you to make sure that you pay attention to these details because they really are important. And I want you to make sure that you remember that I'm in the course 7 days a week. And I'm always here to help you better understand something, clarify something, whatever it takes for you to have real understanding of the concepts, because these are important concepts. They will come up in certification, national certification exams. They will come up on the job. Okay? I'm here for you. Email me if I can help, and I'll see you in the discussion boards.